Hello, everyone, and welcome to the Future of Healthcare Today, a conference brought by you by Siemens Healthineers. I'm Filipe Pinheiro from Digital Services, and I'm here today with my colleague Carlos Parente.
Hello, everyone, and thank you for having us in this great conference in a pretty challenging context. Today, human creativity and will associated with technology and innovation are fostering this amazing event, broadcasting to all of you.
As I said previously, in the next hour, we will talk about the future of healthcare and share with you a glimpse of all the technologies that are futurists, some would say, but already a reality. So, Carlos, tell us what we are going to talk about today.
So today, we will talk about healthcare professionals and the major challenges in healthcare, as well as the digital transition we are living. Also show you a clinical use case of what we are doing to help healthcare professionals in their daily tasks through artificial intelligence, algorithms, and also on decision-making support. Give you insights about hospital boundaries expansion and patients' transition to home care, and finally show you a bit of ongoing innovation that we are working on.
So that seems a great agenda. This workshop will be interactive and will not happen without your inputs. For that, please grab your phone and follow these instructions. Go to menti.com and use the code 8274761 and vote. If you don't have your phone available, you can use any other device with internet access. It can be a computer, a tablet. You can also use the QR code that you see on this side. A QR code, if you use the QR code, you don't need to enter then the 8274761. You enter immediately on the menti.com page. So don't forget to go to menti.com for us to have your feedback and your insights. This workshop will not happen without you. So let's test the Menti platform and ask for your input and test the platform for this first question. So nowadays, there are devices and apps that monitor our agenda, our diets, workouts, sleep patterns, and so on. So let us know what are you currently monitoring in your daily routine. So the code is right here, 8274761. Go to the Menti. So Carlos, do you use any tracking device?
Yes, I do. I use it for working out. It's one of the features. But there are a lot of potentialities today about the devices that monitor our physical activity, and also apps, not only devices, but apps.
Apps, yeah, that we can introduce also manually instead of having all the devices. And we can have a bunch of devices also integrating manually with all the apps. So we have here some answers, 50-50. So we have a split audience.
Oh, yes is winning. We have 7 answers currently.
So I think our platform is working, Carlos. I think we can proceed. Everyone has entered. I think we can proceed. So we have tested.
Yes. So now we're going to Menti again, and going deep in our workshop, please answer us the next question. Give us your perspective in 2 words about what was your driver to embrace a career in the healthcare sector. I'm pretty sure you know there is a demanding job where every day you must make thousands of critical decisions that impact patients, families, and colleagues. So give us your insight. Why did you decide to choose this career?
Yes, and even if you are not from the healthcare sector, give us some feedback on your thoughts about it and on the people that go to this sector. What do you think that's their drive? And if you just entered this workshop, this webinar, we still need your feedback and input. Don't be shy. Go to menti.com and use the code 8274761. So Carlos, what do you think about the results? We have here already some. Generally, it will be the help of others.
Yes. Better knowledge. Makes sense. It's a very demanding area. So you must be very motivated to engage it.
Yeah, I think that's the most of the answers. Help
Very
others.
interesting. Better knowledge.
Make difference also.
Thank you for your answers. Thank you. So as you can see, your drive is similar to the motivation of other people that joined the healthcare sector previously and will join in the future, based on mankind principles of gratitude, solidarity, and compassion. But the difference now is that in our time, we have 4 generations working together and the digitalization of healthcare running on. So today, in our hospitals, we can find baby boomers, Gen X, Gen Y, that I would say it's the majority, but also the Gen Z. So the relations between all these generations and their relation with the technology adoption varies between each other. And that, of course, poses challenges, but also create opportunities for the intergenerational experience, and also through the integration of different perspectives on care delivery, patient experience, and digitalization. And most of you that are participating in this conference as millennials and digitally natives will experience a life where the frontier between your personal life and your professional life will be blurred, since your convergence point will be the same, your mobile phone. And in the future, you can do a lot of things throughout your phone as a technology enabler and an access point. So today you can watch this workshop by the beach or anywhere in the world, and soon you'll be looking to your next weekend adventure, and in the next minute looking for a patient data or even interacting with him. So that's why the experts don't talk about work-life balance anymore, but instead of work-life blend, where professional and personal mix together.
So following this brief context, we would like to have your input again. So in your perspective, please let us know in 2 words, which are the major challenges in healthcare. Go again to menti.com. Please use the code 8274761. And if you have just joined this webinar, please don't forget to give your feedback also at menti.com and use this code. And tell us, what are the major challenges in healthcare? What do you think? Let's go to Menti to see the live answer. Okay, money, misinformation, digital integration, okay, increasing demand.
The aspects related with the chronic diseases is also relevant, and the aging of the population, it sure will poses different challenges and an additional pressure to the system. So technology might be an enabler to resolve these challenges.
Yes, we have here a lot of information, but I think they're connected. We have chronic diseases, technologies, lack of knowledge, misinformation, lack of knowledge, misinformation are together, budget,
and
media,
bureaucracy.
Yeah, bureaucracy, a lot to increasing
Very
demands.
nice.
Okay.
Thank you for your participation. So now moving on, and as most of you said, the developed countries, especially Europe, are facing a progressive aging of population with the advent of chronic diseases and also the healthcare access limitations. Additionally, there is an increase in costs related with the number of beneficiaries, but also related with the therapeutics innovation. We also see a growing concern about patient experience. And as well, the digital transformation is also having a relevant impact in this equation, the same way that already had in other relevant areas of our society, such as world commerce, education, or finance. So now, considering the drivers that you mentioned, we believe that these circumstances will force a change in the way that we approach healthcare delivery, because today we are mainly focused on diagnosing and treating disease, and we are being reactive to this challenge of growing demands. But now in the future, we must look to this in a different perspective, and we must put the patient at the center of care and look to his perspective, focus on health promotion and also in disease prevention. And to achieve this, the financial model must also change from the number of procedures to the attainment of relevant outcomes for patients and families. And we must not forget, even the healthcare professionals at some point will need healthcare, both in sickness and in health as in a marriage.
Give us your perspective about the main drivers that will foster the healthcare delivery and really impact the sector globally. Give us your thoughts in 2 words. So just go to menti.com again if you have closed it. If not, just go there and enter the codes 8274761 and tell us, what do you think will change? What are the main drivers for the future? Okay, we have innovation, digitalization. One person has already answered. Don't be shy. If you have just entered now at our workshop, The Future of Healthcare Today, provided by Siemens Healthineers, just go to menti.com and use the codes 8274761. We want to know your feedback and your inputs. Please, in 2 words, tell us what are the main drivers for the future of healthcare right now. Okay, we have some feedback right now. COVID, digitalization. Yeah,
it changed a lot.
Yeah, and it's
makes sense.
It was a driver, yes. If you have just got to this workshop, go to menti.com and use the code 8274761 to give your inputs here. We want to know the feedback. And the main question we are asking now are, which are the main drivers for the future healthcare transformation? Give us your opinion in 2 words, 1 word.
Available to the patient, telemonitoring, digitalization, artificial intelligence also, cost saving.
I think digitalization is winning.
Absolutely.
Okay, so today, and to cope with this, we have brought to you a clinical pathway to show you how can we support in the full scope of intervention, from screening to follow-up and surveillance, never forgetting about the outcomes that should be continuously monitored for improvement. We will do this with tools such as artificial intelligence in image reading, support decision-making, and remote patient monitoring. So today we brought to you a use case to bring you the future, a future that is already feasible and possible.
So right away, we will travel with you along this clinical pathway of a patient with prostate cancer. As you may know, prostate cancer is the 2nd most common cancer in men, and in Portugal, in our country, represents more than 10% of deaths by cancer. Here we present you Mr. William Johnson. It is a 71-year-old man that started with a classic prostate dysfunction presentation, and his doctor asked for a lab screening including prostate-specific antigen, the PSA, and the results show a PSA elevation when compared with his usual pattern. Now, once again, based on this use case, we will request your clinical expertise to answer a couple of questions using, again, the menti.com and insert the code. So please pick up your phone and go to menti.com again, and you don't need to, if you already inserted your code, you don't need to insert it again.
Yes. So as presented, and before we explain you why do we need your clinical expertise, so we have William. He was prescribed the PSA screening. The values are high. So after screening, we will follow to the diagnosis. And that's where you enter. Here we will need your help. So based on a confirmed PSA elevation, what will be the next steps? A digital rectal examination. B, transrectal ultrasound with biopsy, or a multiparametric magnetic resonance. As Carlos already said, go to menti.com, 8274761. If you have closed it, if not, the slide will pass with this question. Give us your inputs, your clinical expertise much needed here. So don't forget it's right on the side, 8274761. And if you have just entered this workshop, don't forget you can always participate at any time. Yes, Carlos?
I was saying that what is the best next step that you think it's more adequate? So the rectal examination, multiparametric MR, or the biopsy, ultrasound guided biopsy?
Okay, so we have the multiparametric MR winning. Let's take
and also rectal examinations.
Yeah, 33, 50, 17%. Okay, rectal is going up. Okay. We have already 15 people that have answered, and if you have just entered now, go to menti.com, 8274761. Okay, almost a tie. Okay, so let's close this clinical expertise meeting board. And according to the European Society of Medical Oncology, it should be performed a multiparametric magnetic resonance, because from all the possibilities, it is the less invasive and allows clearly identify lesions across prostate. So, for the post-processing of the prostate MR, we can use an artificial intelligence algorithm for image reading. So segmenting the prostate gland is typically a tedious and time-consuming manual task, as you can see on your screen. It takes a lot of time and it can induce to a lot of errors. So what this solution does is automatically segments the prostate gland, and this can gain a much higher efficiency. The radiologists can additionally highlight and outline lesions manually, reducing the risk of information loss. And this might foster collaboration between radiologists and urologists, bringing better performance and clinical outcomes. At the end, we can export the results for the archive and or to the ultrasound equipment to perform the guided biopsy. And that's how we can introduce technology to aid you on your daily life, supporting on the tedious tasks.
So now, after the MR and all of the additional exams, we have a positive biopsy, a glycem risk score assessment, and the tumor staging concluded. Now we must move to the multidisciplinary team meeting. And for this meeting, the update knowledge of all the involved staff, so everyone that participates in this meeting must have a strong knowledge and be updated regarding therapy and intervention. And nowadays, what we see is that dozens of studies are published daily. It is a challenge for the healthcare professionals to keep up with the most recent updated guidelines and recommendations. So following these thoughts, Yes, go ahead, Philip, I'm sorry.
Considering this, we would like to ask you your perspective about this challenging task that you face to keep your scientific knowledge updated. So go to menti.com again and show us your opinion about the percentage of patient complications due to non-adherence to guidelines. We have 3 options. What do you think is the correct one?
Do healthcare professionals can keep up with healthcare professionals could keep up with the updated guidelines constantly?
So 18% is winning so far. Let's take a look. Okay.
So what around 50% of the participants are saying is that 80% of the guideline of complications?
It's a tie now.
Due to non-adherence to guidelines. Okay. Interesting.
We have a tie. Okay, 29% is winning now. A tie again. We are here on a race between 18 and 29%. And I can tell you right now that the correct option is C, 29%. So today the 3P decision should be data-driven and evidence-based, where simultaneously personalized for each patient, considering their preferences. And this is a lot of data to take into consideration. And that is why we have developed an artificial intelligence solution to support the decision making. So here, through a natural language processing algorithm, it is possible to extract clinical information from free text and transform the unstructured data into structured data for better interoperability. So as you can see now on your screen, we have a patient status overview, and we can see above a timeline where we have all the relevant procedures and that are correlated with the orange line that is the PSA value. So here we can have all the examinations correlated inside, and we also have the info on risk assessment, Gleason score, and all the data that really matters. And from the summary chart that is there presented, the solution can correlate all the information that comes from different systems, being radiology, pathology, urology, and bring together this information to create a clear and cohesive picture of the patient diagnostic overview. And based on the patient data and guidelines, the solution provides a decision option features, which suggests treatment or diagnostic options for that specific patient, considering not only the data from these systems and their examinations, the guidelines, but also the patient's preferences. The software also automatically maps the individual patient along the clinical pathway, just like a GPS. Through the clinical pathway guideline tree, it shows where the patient is at a certain moment. We can zoom out and see what the patient has already done and which are the options ahead. As soon as new information is available, the patient mapping is adjusted. And with this solution, we can aid the healthcare professionals to do decisions, data-driven and evidence-based. So the multidisciplinary team meeting has concluded then that the better option for William is to proceed a radical prostatectomy.
Now, after the prostatectomy, we know that the procedure went well. Now we need to move on in Mr. William treatment, since he will be submitted to additional treatments and procedures such as radiotherapy, hormonotherapy, or even chemotherapy. So after the immediate post-op, and in a perspective to promote patient coping, treatment engagement, and reduce the healthcare-associated infections, what, in your opinion, could be the next steps for Mr. William? What would you suggest? Should he move to home care transition with remote follow-up, or should he maintain itself as in a full in-hospital post-op care? Or as an additional option, should he benefit from support remotely and at home to cope with treatment side effects? Give us your inputs and choose the most adequate options through menti.com again.
Yeah, so menti.com 8274761 again. We need your clinical expertise. And don't forget, this could be a multiple choice, giving you some help here. You can choose more than one option. So go to menti.com 8274761.
So home care transition is winning, 62%.
Okay, great. Don't forget, it could be a multiple choice. And if you have just entered this workshop, your feedback is also great for us, and we want to hear you. So go to menti.com 8274761 and let us know.
Good.
Okay.
So, as most of you said, today we can discharge patients earlier without compromise the level of care. So the correct answers would be option A and option C. The promotion of home care improves patient experience, reduces healthcare-associated infections, and provides additional comfort. And in this context, it is possible to provide at-home observations both remotely and physically. So now, instead of being at the hospital, feeling a bed and away from his relatives, Mr. William could benefit from early discharge. And through extramural care, it is possible to expand the hospital physical boundaries and safely follow patients, avoiding unnecessary admissions and costs, promoting efficiency, and allowing to do more with few additional resources.
So in the end, Mr. William will go home benefiting from an awesome clinical management, a great patient experience in a scary context, and a rewarding feeling about healthcare professionals. And now we can look to data and outcomes. So from this point, we can analyze both individually and in an aggregated manner the overall performance using the collected structured data and accurate information to promote continuous improvement, operational efficiency, and scientific leads for research. It's the application of analytics to foster knowledge, innovation, and performance. And as we can see, the future is right here. Today, we can have artificial intelligence, algorithms doing the tedious and standard tasks for us, support on therapeutic decision-making that should be data-driven and evidence-based, and take the hospital with our patients home, without leaving the comfort of their homes.
So personally, for me, there is a world of possibility that arises when we integrate the care continuum with all the relevant participants, including, of course, patients and families. And I would say that this is, in fact, a huge, broad possibilities to go beyond and to innovate and provide better care. Now, before we finish, we would like to give you a brief overview of how far can we go as a team of teams providing healthcare. With this next presentation, our ambition is to spark your creativity and critical thinking and the drive to move outside the box. So here you could have a glimpse of what is the impact of artificial intelligence and healthcare delivery. Now moving on, we will show you another video about 3D imaging and augmented reality. This is embedded in a technology that we call cinematic rendering. And this is when anatomy meets cinema, and we can see all the anatomy structure from different areas of the body, such as tissues, bones, and vessels. This is quite relevant for students to learn with real-life models in 3 dimensions, but also improves patient and physician interaction during an appointment. And it is useful, for instance, in pre-surgery briefings before the healthcare professionals start the procedures. And now the last one, a different healthcare intervention through the impact of buildings that heal people and support staff in their daily activities.
Medicine has changed. Methods of treatment in the past are unimaginable in the present. The medical tools we take for granted today are based on discoveries that once we couldn't even dream of. 200 years ago, who would have imagined we could protect against disease by giving people disease? Then we discovered vaccines. 100 years ago, who would have thought we could fight infection using something we couldn't even see? Then we discovered antibiotics. And medicine keeps moving forward. Now we've discovered that the biggest medical tool in the building is the building itself. A major aid to patient healing is the place where they're healing. A smart building that prevents infection, speeds recovery, responds to emergencies faster, makes people feel better even before treatment. Where technology transforms the entire process. For the patients and for those caring for them. Perhaps the most significant medical discovery of the last 50 years is the impact of the healing environment on patient outcomes. A building that enhances comfort, well-being, and safety for everyone. A building built to heal.
Okay. Thank you so much for your attention, feedback, and interaction. We hope that knowledge and innovation sparks in your life to engage you in an active role on the future healthcare through problem solving and the vision of a better future.
Now, thank you.
We now have.
Yeah. Moving.
Go ahead, Carlos.
Felipe.
Yes.
We'd like to hear from you. We are now open to questions and thoughts. If you have anything that you would like to share with us or questions, and if you want additional information, please use our contacts and give us your feedback.
Okay. Yeah, you can use the same code you're using and the same link, menti.com, 82744761, if you have any comments, thoughts, questions, anything. Okay. Okay. You can leave your comments and thoughts if you have any questions too. Carlos, how can buildings affect so much? This one's for you.
So, as you saw, it is important when we think of a hospital facility to, for instance, ensure that the air circuits avoid the transmission of bacteria and virus. And this is a quite relevant theme in our days regarding to COVID. Also, it's interesting to see that when we have a illumination that follows the circadian rhythm of the people sleep better, and that impacts that sleep pattern impacts favorably in the disease evolution, and patients recover faster. So all the building is designed to really impact the overall health of both patients and also professionals.
Great. What is the sensitivity and specificity of AI systems? I think it will depend on the system itself. That will be my answer.
What happened here is also that when we think...
Yes,
Felipe,
go ahead.
When we think of artificial intelligence, the artificial intelligence works as a tool to facilitate the process decision-making of the healthcare professionals, and also to replace those annoying and non-productive tasks, administrative procedures, and those kind of things. So if we can avoid those tasks in healthcare professionals to do more differentiated activities, we are benefiting the overall system. So that's very, very important to think of the power that artificial intelligence can bring to healthcare. And it mostly focuses on this to avoid errors, but also to simplify some tasks that the healthcare professionals doing manually will take much longer and will consume time that could be optimized to other activities.
Yes. The GPS for the patient in Portugal is not already available because of the natural language processing algorithm. We have to translate it to Portuguese, but it's already being applied in the United States, and fortunately very soon in Portugal. Let's hope.
This is a relevant question because when you think of the natural language processes, what it allows is to solve one of the most relevant problems in electronic medical records, because usually healthcare professionals do the registers in an unstructured way. And what this natural language process allows is to structure those data and bring the relevant information to the patient's decision, to the treatment decision. So
yeah, basically to structure the data, and we can get that text and that data in a structured way, and bring together and correlate, as we were saying in the presentation, correlate this information that comes from disparate systems, and give here some support on the decision making. And that's what it is being done to bring the solution to Portugal. The technology, all the technology we presented, besides the GPS, is already available in Portugal. So the cinematic rendering is available, as well as the AI algorithm. The prostate MR is being released very soon. And what have we presented? The buildings.
It's already a reality, yes.
Yes. I don't believe all the clinical decisions, because artificial intelligence will not make the decisions. We'll support on the healthcare professionals to make better decisions based on data and on evidence. So the decision will never be made by the systems or by the algorithm. The algorithm only aids on getting the relevant data from the different systems and presenting you a scenario and an option, a feasible option for that patient, but never making the decision on their own.
No, and it will be very hard because artificial intelligence works with patterns, and sometimes, and when we're looking at patients, we are talking about complexity, and we are seeing patients that don't have only, as we show here, a prostate cancer. So they have also, besides prostate cancer, eventually other diseases associated, and so the algorithm cannot fit all this data in this broad perspective, because if you think that we have additionally diabetes and hypertension and heart failure, so there are some clinical suggestions that must be pondered and must be eventually avoided because of the complex of these specific patients. And so this is really to support the decision making.
The AI solutions, these AI solutions that we presented, it's a module of the AI Red companion that we have. It's a multimodality and multi-organ solution that comes in different modules. What we have presented here is the prostate MR. It's in clearance for the FDA, but we already have the one for the chest CT already available in Portugal, certified by the FDA, and for the CE certification also, marked CE, where in one simple chest examination, it can process the heart, the aorta, the lungs, and the spine. So with only one examination, it can segment and analyze lesions that these four organs may have. So we have chest CT, we have prostate MR coming, we have the brain MR also, and chest X-ray for now. These are the modules that are coming right now. But the chest CT is already available in Portugal.
And we have already some customers using it in the regarding COVID. Any other question?
We have here one. Do you think there are risks in treating a patient at home? Obviously, there are risks at home and at the hospitals. So I think there are risks in both of the environments. But if we have the solutions for the patient to be at home safely and fully monitored 24/7, I think the risks to be treated at home are less than treated at the hospital. There are less infections, there are less people going in and out. The patient is more comfortable. So if we have certainty about the vitals that are coming and the parameters, I think that the risks of the patient being at home are less than in the hospital. Obviously, that the patient has to be stabilized. But I think that's my opinion. Do you want to add something, Carlos? The risks of the patient being at home are less than in the hospital. Obviously, that the patient has to be What is your vision?
I agree with you. We cannot. We should look at this as an opportunity to expand the hospital physical frontiers and the physical boundaries. And what we see is throughout the medical interventions throughout the history that usually we did all the procedures in the hospital and patients stay at the hospital. And now we talk about ambulatory surgery care, where patients do surgical procedures, stay in a hospital for a few hours and go home. And in the chronic diseases, what we are figuring is that it is possible for these patients to be at home with the clinical support, and they are surveilled. And the main gain of this solution is to avoid the intercurrences and all the side effects of medication. So in this specific case that we presented you, imagine that you have a patient doing chemo and he needs to cope with the side effects of the treatment. So at this point, if he had some point of contact in the hospital to call immediately at the time there is with the pain or vomiting or something, it is interesting to see that immediately could be implemented a solution for that, a painkiller or something to avoid the vomiting and something like that. And that will avoid additional consequences like dehydration or a pain that keep up going and the patient needs to go to the hospital again. So in the remote care, we can avoid all of these situations. And also we can improve the recovery of the patients when we send patients home, but we must interact with them during that period. So this is fundamental. We are not saying that we want to send patients home without any care. We cannot reduce the level of care. We must keep patients being followed by healthcare professionals. We must surveil these patients. And for that, we have the technological solutions to go beyond and to see what's going on at home. So I agree with you, Philippa.
Right.
So this is a quite challenging question. So the vision for the patient as a consumer, I think, is a natural evolution. The bargaining power of the consumers will grow, and what we see is that all the healthcare providers, especially the private healthcare providers, are positioning themselves in this perspective. And some of them are already seeing that of course the investment is on treating and diagnosing, but we must change in prevention and the avoidance of diseases. And so in the future, I think that we'll have an interaction with the healthcare services the same way that we interact with other sectors that help us throughout our journey, our life, and give us some inputs and notify us if we need to do some screening, and we'll check if we do the workouts that we must do, if we cope with the diets, and they will not be only focused on the disease, but also in the promotion of health and in the prevention of disease. So it's a natural trend, I think.
On the maintenance of healthy state. Yeah, that's where we have then all the apps to give our inputs and these tracking devices. It's where we are at. For the chest CT or chest X-ray, yeah, we have an algorithm that was created in a very fast way that we can call it a record. So it is within the chest CTs, the pneumonia analysis, and it can detect if the lesions are COVID-19, are from COVID-19 with a probability also, because it's never diagnosed by the algorithm. But yes, so we have within the chest CT the pneumonia analysis that can detect lesions from COVID-19. It's available in Portugal as well. And in all Europe and US.
If you want additional information regarding this, please contact us. Feel free for that.
Yeah, feel free anytime. It depends. As Carlos said on the presentation, we have like 4 generations today in the field, being that the oldest ones are more reluctant, even for the technology, to start using these kind of technologies. But we see that the youngest generations are very enthusiastic, and they see the need to use this, the decision making, and to support them on these boring daily tasks and manual tasks. Artificial intelligence will give healthcare professionals the time for the patients. It will not replace any healthcare. It will only support their work, because the workload is rising all the time. And what we can see by these technologies is that they can aid on the healthcare professionals spending more time with the patient and more time diagnosing.
I think there is also another aspect that we must consider, that is when we are implementing a new technology or a new way of working, we need some time to adopt this new way to do the things. And I think that these solutions will have its learning curve, and progressively will enter in the hospitals and will be more frequent. Because for an healthcare professional, he is used to see the patient in the hospital and he can check it anytime he wants. And what we are saying is that he must change that vision to have the patient at home, and you only can see it when there is interaction through the platform. So this is also a challenge for the healthcare professionals. They must embrace, and the only way to do this is start with more stable patients, with patients with less complications, and learn from that progressively to have more and more patients outside the hospital. But this must be progressive. It cannot be a drastic change. It takes time.
Yes. Yes, we do have remote patient monitoring solutions that are focused on having the patient on the chronic disease management, where we can have full year program where we manage the patient and give them empowerment and education on how to live with the condition, but also telemonitoring solutions regarding the teleconsultation, on the maintenance of health, as we were saying previously on the question of patient as a consumers. So regarding that, and the patient giving their own inputs, having their own portal where they can have all their data, have a teleconsultation as an urgency, and we can provide those solutions in Portugal.
Do you believe that AI is more valuable to diagnose diseases?
Here, I think it will depend on the algorithm. The algorithm, this kind of things depends on what the algorithm was built, because we can have artificial intelligence with algorithms that are good on predicting risk and predicting diseases, and then we have algorithms that are built and based on getting the data and having probability diagnostics. So I don't think that one is better than the other. I think they are completely different kinds of algorithms. And I think this is a good question because artificial intelligence is a world. So there is not artificial intelligence per se. We have different algorithms with different goals. And that's why I cannot choose one better than the other. That will be my answer. It depends on the goal that is built on the algorithm that is built on. So I think there's no more questions and we are at the time.
Yes.
Okay. So from my
thank
side,
you all.
thank you for, yeah. Go ahead, Carlos, go ahead.
No, I was saying just thank you all. Hope you enjoyed, and feel free to contact us. Here in this slide, you can see our contacts. So feel free to give us a call about anything that you think is related with these topics or with Siemens Healthineers services. Thank you all.
Yes, thank you all.